Dr. Kumari Rachana, study on indications, complications and visual outcome in SLET. Are you there?
Good morning everyone, I am Dr. Rachana and today I will be talking about study on indications, complication and visual outcome in simple limbal epithelial transplantation. I have no financial disclosure. The human ocular surface serves the unique function of forming a resilient barrier to pathogens and environmental factors and provides the metabolic requirements to the underlying stroma and maintain a smooth transparent optical surface. It is composed of two main tissues, that is the cornea and the conjunctiva, with limbus acting as a transition zone. The limbus is composed of radial fibrovascular ridges, the palisades of Vogt, that forms a niche for the corneal epithelial stem cells. Several insults, both intrinsic and extrinsic, can precipitate the destruction of these microenvironment of the stem cells niche, leading to limbal stem cell deficiency. The aims and objectives of my study is to study the various indications for SLET, to analyze the various complications and to evaluate the visual outcome in patients of SLET. This was a prospective study conducted at a tertiary care hospital. A total of 12 patients fitting in the inclusion and exclusion criteria were selected from our routine OPD for this study, and the follow-up were done on day 1, day 7, day 14, 1 month, and then for 1 year each month. Patients with a documented history of chemical or thermal burns and with the presence of unilateral or bilateral limbal stem cell deficiencies were included, while patients with unknown cause of LSCD, patients with untreated concurrent ocular problems such as entropion, trichiasis, etc., and the patients with cases of LSCD occurring after ocular surface tumor excision and radiotherapy for intraocular tumors or without visual potentials, that is for cosmetic correction, and patients not willing for the procedures were excluded. Post-operative assessment were done on the basis of Snellen's visual acuity, ocular digital pressure, staining by fluorescence, Shermer test, and any complications that were present after surgery. So coming on to observations and results, out of the total 12 patients, 84% were male and only 16%, that is 2 patients, were female. And in every age group, the more number of males present than females. Maximum number of patients were, that came to our hospital were in the age group of 20 to 40 years. The patients who came to our institution that has the indication of SLET, among them majority of them has the indication that is because of the injury due to liquid acid burn, that is 5 patients, and only 1 patient had the indication that is dry eye and injury due to plant juice. And the most common pre or baseline finding that is that we found on SLE was epithelial defect that was present in all 12 patients, and 10 patients were having conjunctivalization and corneal vascularization, and only 4 patients has had symblepharon. Visual outcome, the pre of visual acuity of these patients that is being shown in this pie chart. 50% of the patients has the visual acuity of hand movement to finger count close to face, and 17% has the visual acuity less than 6/60. The average post-op visual acuity after 1 year of follow-up was as we can see in this pie chart. 58% has visual acuity more than 6/18, which shows that there has been a improvement in the visual acuity, and only 17% has less than 6/60. This is the tabulated form of the complication that were encountered at the end of 3 months and 6 months of follow-up. We can see that there are more complications seen at the end of 3 months, among which keratitis and dry eye was the most common complication seen in 3 patients, that is of 25%, and at the end of 6 months dry eye was seen only in 2 patients, and rest all the complications were also less. So to conclude, after the 6 months of follow-up of our cases, we see that an excellent result with improvement in visual acuity as well as stabilization of ocular surface. We can see a few pictures from our study that the patients preoperatively has a vision of 1 meter finger count has been improved to 5 meter finger count and to 6/18. And these are 2 more pictures which showing an improvement of from 2 meter to 6/24 and 4 meter to 6/18. So to conclude, autologous SLET can be a successful method in restoring the ocular surface as well as improving vision. Thank you.
Actually, 9 of your patients already had a poor Sharma's to begin with.
Yeah.
So you've shown that as a complication at 3 months. So I don't think that can be included. Maybe one case of keratitis you can mention, but
And what about those patients who have severe dry eyes? What you did about those patients? 2 cases.
Sir, we prescribe them with lubricating eye drops to control, to maintain their ocular surface.
Do you think it will improve, or you need to do a mucous membrane grafting?
So we can go for mucous membrane grafting, autologous grafting.
thank you, sir. Dr. Kumari Rachna, study on Dr. Mosam Mohanty, role of specular microscopy in toxic endothelitis due to latex of Calotropis procera.